Greetings from Geneva. It's such a pleasure to join the IEFS conversation series this week. The COVID-19 pandemic has resulted in unprecedented use of data and digital technologies. New approaches have been used to collect data on cases and contacts, to conduct predictive analytics for epidemic preparedness, planning, and risk assessment, and to use data visualizations for better communications. Despite these advances and an overwhelming volume of information about COVID-19, there remain significant challenges. Specifically, we face limits to timely public health data sharing and access from member states and other public health institutions due to concerns about privacy, intellectual property, and technology barriers. At the same time, we're facing the rapid spread of misinformation during this pandemic, especially through social media. As you know, we call this an infodemic. WHO is working with partners, of course, including tech companies, to fend off harmful falsehoods. Looking ahead, we must lay the foundation for a more robust global data architecture for epidemic detection, risk assessment, and response. As you know, WHO's vision for a global web of public health knowledge is called EpiBrain. This global data ecosystem could rapidly detect and assess epidemics and share information in real time. We're working with partners, including CERN, to make this vision a reality. The pandemic exploits the inequalities in our societies and the gaps in our health systems. So-called lockdowns have been mandated by many countries to slow the spread of COVID-19, but they can have unintended consequences, particularly for low income and other marginalized groups that depend upon their daily work to survive. Lockdowns increase the risk of domestic violence, especially for women and children, as a recent study actually indicated. And people with disabilities are at particular risk due to stay-at-home orders. They must be able to access all of the services they require during this outbreak. Governments must find ways to mitigate the impact of stay-at-home orders on lives and livelihoods through social safety net programs when necessary. There are social safety net programs in many countries, and countries can use their own ways of supporting those who need support. And countries and partners must pay special attention to avoid stigma and exacerbating existing inequalities and not make excessive use of emergency powers. It's essential to include vulnerable groups in the planning for all national response measures, incorporating their concerns into national approaches. That kind of involvement of communities is very important. It builds trust also and builds relationship with the society. And this must be addressed in countries' preparedness and response plans for COVID-19. WHO has published policy briefs and guidance for countries on how to minimize the impact of COVID-19 on the most vulnerable populations. Many people around the world depend on their daily work to feed their families. They may be forced to choose between earning an income and staying at home for public health. But that's no choice at all. We have to work with governments and employers to protect both lives and livelihoods. It's critical that stay-at-home orders and other restrictions be balanced against other risks affecting communities, such as lack of income, access to basic services, and food insecurity, of course. In low-income communities, as well as in humanitarian settings, risk assessment should be done to address threats to health and the socioeconomic impacts of public health measures. Households that lose their sources of income will need social protection schemes, which may include cash transfers or having additional access to staple foods and land. Where possible, local markets and food systems should be supported. The bottom line is that all countries must ground their response to the pandemic in the principle of solidarity. And that's why we say solidarity, solidarity, solidarity in the fight against this pandemic. We're all in this together, and we can only overcome it together.